On International Women's Day, we're talking all things women's health today. Our resident health expert, Dr. Tamara Hunter, joins me now. Good afternoon to you, Tamara.
Hi, Tracy.
What are some of the biggest health issues women face in Australia?
Well, cardiovascular disease is still the biggest issue for women, with 1 in 10 women suffering with ischemic heart disease. Now, that has decreased by about 21% from 2007 to 2017, but it's still a big issue. And one of the biggest risk factors is actually obesity, with 30% of women being classified as obese, 60% of women being classified as overweight.
Wow.
Cancer is still a big issue. 1 in 3 women at risk of cancer, but we're doing better than men. They're 1 in 2 risk. Mental health is also a big issue. 1 in 6 women having depression, 1 in 3 having anxiety. So there's lots of things that we need to look after women with.
Well, what can we do? What needs to be done to address these issues?
So if we look from a cardiovascular health point of view, it's preventative health. So get moving, watch your weight, lose weight if you need to, stop smoking, eat lots of whole foods, fruits and vegetables, lean cuts of meat. As far as cancer goes, skin checks, breast checks are really important. Slip, slop, slap is key. And looking after, making sure you do those screening programs. And from a mental health perspective, always reach out to people and ask them, are you okay?
Absolutely. It's also Endometriosis Awareness Month. We are hearing more about it thanks to some high-profile women speaking out about their own experiences with the disease, like Emma Watson of the Wiggles. But how much of a problem is it?
Look, this is a huge problem. 1 in 10 women suffer with endometriosis. It's the growth of the lining of the womb outside the womb and in the pelvis, causes anything from severe pain right through to infertility. 176 million women around the world suffer with this problem. And the problem is that it's 7 to 10 years delay in diagnosis due to the vagueness of the symptoms.
Okay, so are there any kinds of symptoms at all? I mean, as you said, they're quite vague, but what can be spotted or what can be mistaken for something else?
So a lot of doctors and patients alike will minimise their symptoms of severe period pain or bowel-related symptoms. IBS is a common presentation with endometriosis. Up to 40% of women who are infertile actually have endometriosis as well. And the thing about the disease, the severity of the disease often doesn't correlate with the level of the symptoms. So some women with severe disease have no symptoms at all.
All right, I have to leave it there. Dr. Tamara Hunter, thank you so much for your time.
Thanks, Tracy.